Hello everyone, good afternoon. Mansi, Priyanshi, Arishi, everyone is present now. Muskan, Aditi,
Good afternoon, sir.
good afternoon, good afternoon. So today we start a new chapter, that is galvanic current. In last class we had discussed Faradic stimulation. So today we will discuss galvanic current or galvanic stimulation, right? So first we discuss galvanic current, the characteristics of galvanic current, what is galvanic current, what are the features of galvanic current, right? So basically, galvanic current is a therapeutic direct current. It's a therapeutic direct current. So its direction of polarity is constant and passes continuously in one direction only, right? That's why it is DC, direct current, because it flows in one direction only, right? So in most of the therapeutic references, it is known as galvanic current. So galvanic current is also known as therapeutic direct current. Here, it is also called as constant current, right? An Italian scientist named Viggi Galvani found that when the sky lightning is introduced in the frog's muscle through a copper wire, muscles get contracted. So, an Italian scientist named Viggi Galvani, he worked on the effects of galvanic stimulation. So, he found that when the sky lightning is introduced in the muscle of the frog's leg through a copper wire, muscles get contracted. Clear? One second. Hello? बोलिए ले लो ले लो Yes. So there was a scientist named Viggi Galvani. So he found that when the sky lightning is introduced in the muscles of frog's leg through a copper wire, muscles get contracted, right? So this is the effect of the skylight, that is direct current. So to honor them, to honor him, the name of DC is given as galvanic current, right? So DC is named after the scientist Viggi Galvani. So the name of DC is given as galvanic current, right? So galvanic current is a therapeutic direct current. Clear? Next point is, if we apply galvanic current to a muscle, it will contract and will remain in contraction till the current is not brought to zero, right? Means when we apply galvanic current to a muscle, अगर हम किसी muscle में galvanic current introduce करते हैं, so the muscle will contract, right? And the muscle will remain in contraction till the current is not brought to zero. मसल में कॉन्ट्रैक्शन तब तक रहेगा जब तक करंट जीरो नहीं हो जाएगा, राइट. So during treatment, our purpose is to get the muscle contracted and relaxed. So which is possible only when we apply the current for a shorter duration, right? तो हमारा क्या काम है, हमारा पर्पस क्या है? Our purpose is to get the muscle contracted and relaxed. Muscles को आपको contract करना है और relax करना है, which is possible only when we apply the current for a shorter duration, right? ये तभी हो सकता है जब आप शॉर्टर ड्यूरेशन के लिए करंट फ्लो करें, एंड देयर शुड बी अ साइलेंट पीरियड, और उसके बाद कॉन्ट्रैक्शन देने के बाद वहां पर एक साइलेंट पीरियड होना चाहिए, एक पॉज होना चाहिए ड्यूरिंग द टू पल्सेस, राइट. तो देयर शुड बी वन इम्पल्स, देन पॉज, देन अगेन सेकेंड इम्पल्स और नेक्स्ट इम्पल्स, राइट. So basically our purpose is to get the muscle contracted and relaxed. The muscle में contraction होना चाहिए और muscles relax होने चाहिए, right? ये तभी हो सकता है जब हम एक current flow कराते हैं एक particular time के लिए और उसके बाद एक pause भी होता है, right? So there should be a pause between the two impulses. Clear? So in this way we can contract the muscles and we can relax the muscles alternatively. So this type of galvanic current is called interrupted galvanic current, right? Or intermittent galvanic current. So इस तरीके की जो galvanic current है, that is called interrupted galvanic current. There is an interruption in between the two impulses. Or intermittent galvanic current, right? We can also say it's a intermittent galvanic current. So this type of galvanic current is called as interrupted galvanic current or intermittent galvanic current. Clear? Next thing is the types of intermittent galvanic current. Now we discuss types of intermittent galvanic current. There are so many types. Like one is rectangular type of galvanic current. Another one is triangular type galvanic current. Next one is trapezoidal galvanic current, sawtooth galvanic current, and depolarized galvanic current. Right? So these are the different types of intermittent galvanic currents. Right? Now we discuss one by one. Like first one is rectangular type of intermittent galvanic current. Intermittent means there is a pause between the two impulses, right? So in rectangular intermittent galvanic current, there is a sudden rise and short stay at the peak and sudden fall in the impulse, right? It's a rectangular type. We have seen rectangle, right? The current will be a rectangular type. That's why it is known as rectangular intermittent galvanic current. In this, the current is rising suddenly, right? It stays at the peak for a short period of time and sudden fall in the impulse we can see, right? So it makes a rectangle. Current increases suddenly, it stays at the peak for a period of time, then decreases suddenly, comes to zero, right? So it is known as rectangular type of galvanic current. Clear? Sudden rise and sudden fall in the impulses and short period of time at the peak. So it's a rectangular type of intermittent galvanic current, right? The other type is triangular intermittent galvanic current. Clear? So when there is sudden rise and fall of the impulse with no stay at the peak, so it is a triangular type of galvanic current. Triangle. It forms a triangle. In this, the impulse rises suddenly, right, and falls suddenly, right, and there is no stay at the peak. So it is known as triangular type of galvanic current, right? It's increasing and decreasing. Triangular type. Next one is trapezoidal type of galvanic current. Trapezoidal. When there is gradual rise and fall of impulse with a short stay at the peak. So there will be a gradual rise and gradual fall with a short stay at the peak, right? In this, the current will increase gradually, it stays at the peak for a short period of time, then decreases gradually. This is known as trapezoidal type of intermittent galvanic current, right? Trapezoidal. Next one is sawtooth type of galvanic current. When there is very gradual rise but sudden fall of the impulse. The sawtooth type of intermittent galvanic current. We have seen saw, है ना, सॉ और आरी हम लोगों ने देखा है और आरी को देखा है, तो उसमें जैसे उसके दांत होते हैं सॉ टूथ, राइट, कैसे होते हैं, राइट, inclined line with a straight line, straight vertical line, right? So sawtooth intermittent galvanic current. So when there is a very gradual rise but sudden fall of the impulse, that is known as sawtooth type of galvanic current, right? Next one is depolarized galvanic current. Some stimulators produce reversal polarity between the intervals and it is called as depolarized current, right? So some stimulators produce reversal polarity. In this, polarity will reverse between the intervals and this is called as depolarized current, right? So these are different types of intermittent galvanic current. Intermittent galvanic current may be of rectangular type, triangular type, trapezoidal type, sawtooth type, and depolarized intermittent galvanic current, right? So in all the above types of currents, pulse width of about 100 millisecond of desired amplitude and 30 cycles per minute frequency is used, right? And however, the duration and the frequency of the current can be selected by the therapist as desired, right? But the pulse width of the current should be around 100 millisecond of desired amplitude and the frequency should be around 30 cycles per minute, means 30 hertz, right? So now we discuss physiological effects of interrupted dead current. Physiological effects of interrupted direct current. So, provided that the intensity of current and duration of impulses are adequate, a contraction of denervated muscle can be initiated. Right? So, as we know, Galvin current stimulation we use for denervated muscle contraction. Right? And the Faraday stimulation we use for stimulation of innervated muscle. Right? So, intensity of current and duration of impulses should be adequate to produce a contraction in denervated muscle. The contractions are sluggish, the contraction and relaxations being slower than when the motor nerve is stimulated. So, as denervated muscle tissues does not have the same property of accommodation as motor nerves, so a current that rises fairly slowly is as effective in producing a contraction as one that rises suddenly. Right? So the current impulse which is increasing gradually, right? That is more effective than the current which goes up suddenly. Right? So this rise should be gradual. So that will give a more accurate and effective result. So moreover, the slowly rising current can produce a contraction of innervated muscle with a current that is insufficient to stimulate selectively the motor nerve. Clear? So an impulse with a duration of 100 milliseconds is the shortest that is generally considered satisfactory for the treatment of denervated muscles. So we can produce contraction in a denervated muscle by giving galvanic stimulation, right? So both of these factors should be taken into consideration before treatment of the patient. Means pulse width, frequency, duration, intensity, right? It should be sufficient to produce muscle contraction. So when interrupted DC is applied to the body, there is a stimulation of sensory nerves, right? The impulses are of fairly long duration, so the effect is rather marked, giving rise to a stabbing or burning type of sensation. Because when we use this galvanic stimulation, patient feels a stabbing type or burning type of sensation, right? And there is a reflex dilatation of the superficial blood vessels and consequent edema of the skin. So, because of this galvanic stimulation, there will be a reflex dilatation of the superficial blood vessels, right? Vasodilatation means dilation of diameter of arteries, right? And that will increase the blood flow, and that may cause edema of the skin. So reflex vasodilatation of the superficial blood vessels and edema, right? Redness on the skin, right? Next one is stimulation of motor nerves with interrupted DC reduces contraction of the muscles supplied. So the stimuli are frequently repeated. So each one produces a brisk muscle twitch followed by immediate relaxation. The twitch means contraction, muscle contraction, and that will be followed by relaxation. Right? Point is, by using galvanic current, we can stimulate motor nerves as well as sensory nerves. Right? So these are the physiological effects of galvanic current, interrupted DC. Another point is, anybody want to ask something? Anyone? Aditi, Ayushi, Jyoti. Okay. Next point is, if we stimulate motor nerve with interrupted DC, it will also produce the contraction of muscle supplied. But because of frequent repeated stimuli, it produces a brisk muscle twitch followed by immediate relaxation, and thus effect of this is very less beneficial on the muscles. Right? Next point is, intermittent galvanic current also stimulates sensory nerve, and the effect of this current is marked due to long duration impulse which give rise to stabbing or burning type of sensation. Right? So when the sensory nerve is stimulated either by Faradic or galvanic current, it also produces a reflex vasodilatation of superficial blood vessels. So slight edema is seen. So this vasodilatation is limited up to the superficial area only. Right? So either we use intermittent galvanic current or we use Faradic stimulation. Both gives the effect of reflex vasodilatation of the superficial blood vessels and edema. Right? Next point is, when the any nerve is damaged severely, there occurs degeneration. Right? In last class, we had discussed about nerve degeneration: first degree nerve injury, second degree nerve injury, and third degree of nerve injury. Right? So when any nerve is damaged severely means third degree nerve injury. Neuropraxia, axonotmesis, and neurotmesis. First degree, neuropraxia. Second degree, axonotmesis. And third degree of nerve injury is also known as neurotmesis. In case of neurotmesis, the nerves will be degenerated. Right? So after degeneration, muscle can be stimulated by interrupted DC. Clear? But degeneration takes long time. So in early stage after the injury, the muscle can be stimulated by the Faradic type of current, and after degeneration, after some time, we can use galvanic stimulation. Right? So these are physiological effects of interrupted galvanic current, or we can say it's a effects of interrupted direct current. Right? Now we discuss indications. Indications means the conditions where we can use the galvanic stimulation. Indications of galvanic stimulation. Point is the most significant use of galvanic current in electrotherapy is the stimulation of denervated muscles by non-continuous mode. Right? Means by the galvanic current we can stimulate denervated muscles. Right? So a denervated muscle or group of denervated muscles cannot contract and relax. Thus, blood supply of such muscle or muscles is decreased, resulting into wasting. Right? So, because of degeneration of nerve, the degenerated or denervated muscle or group of denervated muscles will not contract and will not relax because they are denervated muscles. Right? There is no supply of impulses. So, what will happen? If the muscles will not contract and relax, the blood supply of the muscles will be decreased, and that will result in muscle wasting. Right? So, after a long time, such muscles lose their property of contraction and get hypertrophied or atrophied. Right? Means the muscle will not work properly or they are denervated muscles. They will not contract and relax. So what will happen? The muscles will be hypertrophied or atrophied. Right? Because lack of blood supply in these muscles. Right? So muscles will be hypertrophied or atrophied because of degeneration or denervation. Clear? So a current of 100 millisecond is applied on such muscles to produce contraction. A current below 100 millisecond duration will not stimulate all the muscle fibers. Normally we use 100 millisecond, right? Or more than 100 millisecond, right? So basically, in denervated muscles, we use intermittent galvanic current to produce muscle contractions. Clear? Now we discuss how should we select the type of impulses in conditions, different conditions. So if a good muscle contraction is obtained with a rectangular impulse, this may be used, but the selective impulses often prove more satisfactory. So the difference between the various types of impulses lies in the time taken for the intensity of current to rise to maximum with the rectangular impulses. So the rise is sudden. With the trapezoidal, it is fairly slow. With the triangular, even slower. And with the sawtooth, so slower still. So provided that the impulses are of same duration, a slow rise in intensity of current has the advantages that a contraction of denervated muscle is often obtained with less sensory stimulation than when rectangular impulses are used, and that denervated muscles often responds to a lower intensity of current than that required to stimulate motor nerves, so that unwanted contractions of the normally innervated muscles in the region are eliminated. Right? So, in long standing denervation, a muscle contraction may be obtained with a slow rising current when there is no longer any response to a rectangular impulse. The best type is which increases gradually and comes down gradually. So, when various types of impulses are available, it is advisable to attempt stimulation with each in order to ascertain which produces the most satisfactory contraction. So it is often found that the more long standing the denervation, slower the rise in intensity of the current that is required. Right? Next is duration of impulse. Point is an impulse of at least 100 millisecond is necessary in order to ensure that all the denervated muscle fibers are stimulated. Right? So a current of 100 millisecond or more than 100 millisecond impulse should be used to stimulate muscle contraction. If shorter impulses are used, some of the muscle fibers may fail to contract, right? So when we use shorter impulses, some of the muscle fibers will fail to contract, right? All the muscle fibers will not participate, all the muscle fibers will not contract. When we use short impulses, less than 100 millisecond impulses. Clear? So when attempting to eliminate contractions of normally innervated muscle or to stimulate a muscle which has been denervated for some time, it is necessary to increase the duration of impulses to 300 to 600 millisecond. Right? So impulse duration should be more than 1 millisecond. Normally we use 100 millisecond to stimulate innervated muscles, right? So these are the characteristics of galvanic current. We have discussed types of intermittent galvanic current, physiological effects of intermittent galvanic current, indications and selections of types of impulses, right? Now we discuss methods of application, right? There are two ways to apply galvanic current on the affected part of the body, called labile method and a stable method. Means there are two techniques or two methods which we use in lab. One is labile technique, labile, Labile, labile technique, and stable technique. Second one is stable, stable, stable technique. One is labile technique and another one is stable technique. So both the techniques we use in galvanic current stimulation. Now first we discuss labile method. So one muscle is stimulated at a time and the anode is kept on the origin of the muscle and the cathode is placed on the belly of the muscle or on the nerve trunk, right? So anode is kept on the origin of the muscle. You have to place anode electrode on the origin of the muscle, and cathode on the belly of the muscle or nerve trunk, right? So cathode is moved slowly in the whole muscle to get every muscle fibers stimulated. So thus, this method is widely used. So this is known as labile method, right? So in labile method, we use two electrodes. One electrode is anode, one is cathode. We place anode on the origin of the muscle. So you should know the origin of the muscle. So you have to place anode on the origin of the muscle, and cathode should be placed on the belly of the muscle or on the nerve trunk, right? On the motor point you can apply, or on the nerve trunk you can apply, that is cathode. And the cathode should be moved slowly in the whole muscle to get every muscle fiber stimulated, right? So thus this method is widely used. This method is known as labile method. Labile, labile method, right? The other method is stable method. Stable, stable method. So in stable method, anode is kept at the origin and cathode is kept at the near the other end of the muscle and pressed firmly. So we have to place anode on the origin point, and cathode is kept near the other end of the muscle and pressed firmly. We can place anode on the origin point and cathode on the insertion point. In the stable method, you have to fix both the electrodes over the muscles. So this is the stable method. So then there is no need to move the cathode. It is better if the skin is moist before applying the electrodes. So in case of loss of sensation, repetitive small settings should be given to avoid electrical skin burn, right? So we should moisten the skin before applying the electrode. This is the main precaution we should take. And in case of loss of sensation, always check the skin condition first, then apply the electrodes, right? So in case of loss of sensation, repetitive small sittings should be given to avoid electrical burn, right? So about 70 to 90 contraction each muscle is given in one sitting. Clear? So at the end of the sitting, remove electrodes and apply talcum powder over the electrode area, right? So these are the two methods. One is labile method and another one is the stable method, right? In labile method, we keep anode on the origin of the muscle and we place cathode on the belly of the muscle and we move cathode slowly, right, in the whole muscle to get every muscle fiber contracted, right? So this is known as labile method. And in stable method, we place anode at the origin point and the cathode at the insertion point of the muscle and we fix it with the straps, right? So that's why it is a stable method. Both the electrodes are stable. That's why it's a stable method. So one is labile method and the other one is a stable method. Clear? Next thing is preparation of the equipment. Always check the machine first, right? Prepare the patients, right? Check the machines, all the knobs and leads, electrodes. Here, so the operators is tested and the other equipment prepared as for the treatments previously described, right? To make sure that the coverings of the disc electrodes and the pads consist of at least 8 layers of lint. In this, we use two electrodes, one is cathode, one is anode. We can place these electrodes in the sponge pad, or we can use 8 layers of lint. Lint is a cloth, right? So 8 layers of lint we can use. So this is because it is possible to get chemical burn with long duration pulse if the treatment is given at the same spot for a long periods of time, right? Particularly if the current selected is without the reverse wave of the current between the impulses. So to avoid chemical burn, we should use 8 layered lint or 8 layered cloth we can use. Okay? Next point is no metal should be allowed to come into contact with the patient's tissues. There should be no metal in contact with the electrodes. Right? Now we discuss preparation of the patient. Preparation of the patient. Point is the skin is prepared by washing and protecting the abrasions as for other electrical treatments. Right? So we can reduce the skin impedance by washing. So first, ask the patient to clean the area, right? And we can protect the abrasions or small cuts with jelly, right? So it is often an advantage to soak the part in warm water before the treatment to lower the resistance of the skin and to warm the muscles. Although of the skin and to warm the muscles, although there is a extensive loss of sensation, care must be taken that the water is not too hot, right? Always check the patient's skin condition first. Check the sensi level of the skin, right? Then you can proceed. So to reduce the skin resistance, what we can do? We can wash the area with the warm water, right? And if there is an extensive loss of sensation, care must be taken that the water is not too hot. You have to check the water's temperature. Next point is contractions are often most easily if the part is supported so that the muscles to be stimulated are in a shortened position, right? So alternatively, the current may be applied with the muscles in a partly lengthened position. So this should only be done if the contractions produced are sufficiently strong to cause shortening of the muscle and so joint movement. So this is achieved. The load opposing the muscle action should increase the beneficial effects. So it is usually possible to produce movement only in smaller joints like wrist. right? So this is preparation of the patient. So preparation of the machine, preparation of the operators, preparation of the patient, all these are important. Next is application of interrupted DC. So the muscle contractions are obtained most easily if the active electrode is connected to the anode, right? But this is not always the case. Means you can change the electrode. So each patient should be tested to determine whether the anode or the cathode produces the better response and the more effective the pole used for the active electrode, right? So when the electrodes have been applied, the intensity of current is increased until a good muscle contraction is obtained. So a large number of contractions of desirable, but any sign of fatigue, such as weakening of the contractions, is an indication for limiting the length of treatment. So the contractions are usually produced in the groups, allowing rest periods in between. That's why we use interrupted galvanic current, because the patient feels a stabbing type of sensation when we use this galvanic current. That's why we use normally intermittent galvanic current, right? Means there is a pause between the two impulses, right? So as we know, the interrupted galvanic current is of a long duration current ranging from 1 to 300 millisecond, maximum up to 600 millisecond. It has a lower frequency than Faraday. It is used to stimulate innervated muscles, and it gives stabbing type of sensation, right? So these are the characteristics and mode of application of galvanic stimulation, right? So if you want to ask something, you can ask. अभी आप कुछ पूछना चाहते हैं पूछ सकते हैं. मानसी, मुस्कान, आयुषी, आकांक्षा. This is all about galvanic current. Now we have completed magnetic stimulation and galvanic stimulation. Yes, Akanksha.
हेलो. गुड आफ्टरनून सर.
Good afternoon.
सर एक्चुअली इससे रिलेटेड नहीं था, मेरे को ये पूछना था कि सर जैसे कोई पैरालाइज्ड पेशेंट है अगर, और उसका लेग जो है वो पूरा पैरालाइज्ड है, तो उस लेग में सेंसेशन हो रहा है या नहीं हो रहा है, ये किस मॉडलिटी से पता लगाता है?
सेंसेशन हो रहा है या नहीं हो रहा है कैसे मालूम होगा?
हाँ, नर्व सेंसेशन कितना है कि नहीं है, और ये सब कैसे पता लगाए?
तो फर्स्ट यू आस्क द पेशेंट. ठीक है, आप पेशेंट से पूछिए कि उस पेशेंट को फील हो रहा है या कुछ नहीं हो रहा है. फॉर दैट यू कैन यूज फिंगर टिप्स, राइट? यू कैन यूज ब्लंट ऑब्जेक्ट. कोई भी आप ब्लंट ऑब्जेक्ट यूज कर सकते हैं. पेन यूज कर सकते हैं, पेन कैप यूज कर सकते हैं, राइट?
ओके.
और फिदर यूज कर सकते हैं. तो आप जब टच करेंगे तो पेशेंट से आप पूछें किस एरिया में आपको फील हो रहा है या नहीं हो रहा है, राइट? ऑल दिस डिपेंड्स ऑन द कंडीशन. प्रॉब्लम क्या है उस पर डिपेंड करता है. मीन्स अगर स्ट्रोक पेशेंट है तो उसमें भी अल्टर्ड सेंसेशन हो सकता है. पैराप्लेजिक पेशेंट्स हैं उनमें अलग सिम्टम्स देख सकते हैं. अगर ठीक है क्वाड्रिप्लेजिक है उसमें भी दिखते हैं, सेंसी लॉस होगा. या फिर पेरिफेरल नर्व इंजरी से उस केस में भी सेंसी लॉस होता है. बट डिपेंड्स ऑन कंडीशन. SCI है, स्पाइनल कॉर्ड इंजरी पेशेंट्स हैं, तो उसमें आपको अगर कंप्लीट टाइप है या इनकम्प्लीट टाइप है उस पर डिपेंड करता है. ठीक है।
तो मतलब सर कोई मैकेनिकल मतलब इलेक्ट्रिकल कोई मशीन नहीं यूज होती
प्रैक्टिकल
है?
मोडेलिटीज अभी ऐसे नहीं है कि वो आप सेंसर्स कुछ ऐसे हों जो चेक कर ले।
हाँ।
पावर चेक
ठीक
करने
है
के
सर।
लिए तो है, आइसोकाइनेटिक मशीन्स हैं, राइट। पावर आप चेक कर सकते हैं, एमएमटी कर सकते हैं, बट
ओके
अभी
सर।
सेंसेशन के लिए एज सच अभी उतना नहीं है। कुछ चीज़ें हैं जो रिसर्च में है,
हम्म।
लेकिन प्रैक्टिकल यूज़ में नहीं है,
ओके
राइट।
सर।
तो उसको आप नॉर्मली पेशेंट से पूछ कर ही आपको चेक करना
ओके सर। थैंक यू सर।
है, राइट। और कोई कुछ पूछ सकते हैं, पूछना चाहते हैं? So there is a big difference in between static stimulation and galvanic stimulation. That is, we use static stimulation in innervated muscles and galvanic stimulation in denervated muscles. Right? Denervation means कहीं पर इंजरी हो गई है, मसल्स डिजनरेट कर रहे हैं, लेकिन डिजनरेशन में थोड़ा सा टाइम लगता है, राइट। तो अगर उससे पहले आप देना चाहते हैं, ट्रीटमेंट देना चाहते हैं, मसल्स को कॉन्ट्रैक्ट कराना चाहते हैं बाय स्टिमुलेशन, so you should go for cardiac stimulation. अगर denervated muscles हो गए हैं, degeneration हो गया है, then you should go for intermittent galvanic stimulation, right? So this is all about galvanic stimulation. Okay, so see you tomorrow, right? If you have any queries, you can ask.